Next, I'm pleased to introduce our next anchor panel. This panel is convened by experts at UC Davis, and it will explore how air pollution affects the health of people, animals, plants, and the shared environment. Please welcome Dr. Samantha Ying from UC Riverside, who will introduce us to climate resilience and air quality, the One Health approach. Her stellar panel, she will introduce. Dr. Ying is an assistant professor of soil biogeochemistry at UC Riverside and co-director of the UC GHI Planetary Health Center. Samantha, over to you.
Thanks so much, Camille. Welcome everyone to our panel today on climate resilience and air quality, the One Health approach. As Camille mentioned, I'm really excited and honored to be the moderator for our panel. My pronouns are she, they, and I'm an assistant professor in the Department of Environmental Sciences at UC Riverside. But as Camille mentioned, I'm also the co-director of the UC Global Health Institute Planetary Health Center. And I'm really excited to facilitate today's topic of air quality and climate resilience, and also especially how this issue intersects with diversity, equity, and inclusion in our society overall, the scientific community, and even within the organizations themselves that our panelists are currently working in. So today we're really lucky to have the chance to hear from established air quality scientists that represent multiple sectors, including industry, academia, and government agencies. And we have Dr. Chang, Dr. Miller, and Dr. Herring today. Dr. Edie Chang has been a deputy executive officer at California Air Resources Board, CARB, since 2013. And in this role, she's responsible for directing CARB's scientific, technical, and planning teams as they develop plans required by federal law to meet air quality standards for all areas of the state that exceed health-based air quality standards. And she also oversees strategies to reduce emissions from freight transport, gasoline dispensing, and small engines. And in her 28-year career with CARB, she has worked on a wide variety of projects, including development and implementation of the state's climate change scoping plan, implementation of the cap and trade regulation, and the low carbon fuel standard, and implementation of the zero emission vehicle program. And diesel incentive programs. So as you can see, it's very comprehensive experience that Dr. Chang brings us. And she received her Bachelor's of Science in Mechanical Engineering from our own system, the UC Berkeley, and a Master's in Mechanical Engineering from Irvine. Our second panelist is Dr. Lisa Miller, who is a professor of anatomy at UC Davis School of Veterinary Medicine, and Dr. Miller received her PhD in comparative pathology from UC Davis and completed a postdoctoral fellowship in immunology at Stanford. She currently serves as the Associate Director of Research, Respiratory Disease Unit Leader, and Inhalation Exposure Corps Leader at the California National Primate Research Center. And is an appointed member of the Scientific Review Panel on Toxic Air Contaminants for Cal EPA. Her research is focused on investigating the impact of environmental exposures on pulmonary and immune system development during early life. Her work on California wildfire smoke exposure in young rhesus monkeys has been frequently highlighted in news media, including BBC, ABC, and Reuters. And finally, in 2020, she was inducted as an American Association for the Advancement of Science Fellow, the AAAS Fellow, and her research on environmental mechanisms of lung injury. And then finally, our last panelist is Dr. Susanne Herring. She is the founder of Aerosol Dynamics, a small business that specializes in the development of instrumentation methods for characterizing airborne particulates. She and her coworkers have developed methods for counting, sizing, and collecting ultrafine and nanometer-sized particles. And Dr. Herring served as the president of the American Association for Aerosol Research, and in 2020, she was honored with the launch of the Susanne V. Herring Award, which specifically recognizes accomplishments in aerosol research that help improve understanding of aerosol impact on public health, the built environment, and global ecosystems. And Dr. Herring holds a PhD in physics from the University of Washington and completed her postdoctoral fellowship in environmental engineering at Caltech. So with that, I'd like to hand it over to each of our panelists who will take turns giving overviews of their work and their experience in air quality and its intersect with climate resilience, followed by a little back and forth Q&A if we have the time. So Dr. Edie Chang will kick off our panel with a presentation of her work. And I will hand it over to her now.
Great, thank you, Samantha, for the introduction. So I'm going to pull up some slides. Let me see if they work. And the first thing that I feel like I really need to say, though, is that I don't have a doctorate. And although my dad would have loved for me to get a doctorate, that wasn't in the cards for me. So, but I'm so pleased to be here today representing the Air Resources Board. You may be thinking to yourself, who is the Air Resources Board? So we're basically the state air quality agency. We work with local air districts, sort of the county level or multiple county level, and US EPA in working to clean the air in California. So if you have heard of us at all, you really think about us in terms of what we do for cars and trucks. We're working to implement the governor's executive order to get cars and trucks as clean as possible. But cars and trucks are definitely not the only sources of air pollution. So there's also stationary sources, the stuff that stands still, mostly regulated by air districts. CARB and US EPA to mobile sources, things that move. We collaborate on things like consumer products, hairspray, stoves, and then the natural environment. And we wanted to really focus today on wildfires. So I'm going to spend a little bit of time talking about wildfires and sort of what CARB's role is in this space. Whoops, wrong way. Wildfire is becoming a much, much bigger issue in California. We're having more wildfires and we're having bigger wildfires. The acreage from wildfires has doubled in the past 30 years, and it's a combination of factors, including past forest management practices where we put out all the fires, even though fires are a really integral part of the natural ecosystem in California. We're also seeing impacts of climate change. Honestly, climate change is making wildfires worse. Droughts that are climate change related, more extreme temperatures are drying out the fuels that are in the forest. They make the trees more susceptible to bark beetles. It weakens the trees. It's sort of this vicious cycle. And we are thinking about sort of it is a one health concept. We care about people's health, but we also care about the health of the environment because these things are interrelated. And we're doing more and more work in this area as our work in climate change increases. Wildfire is also not just a rural issue. In 2018, the Camp Fire in Butte County was the most destructive fire in California history. And during that time, it smoked out all of Northern California. Our building, we were in the office at the time, has very, very good filtration in the building, and we had smoky hallways. It was really painful to be at work, and even worse probably to be at home because the situation here is even leakier. And all of you have probably experienced that over the last couple of years as we've seen really, really severe wildfire seasons in 2020 and 2021. So US EPA sets health-based standards for air quality, and as wildfires basically, they kind of blow those health-based standards out of the air when we're inundated with fire like that. We know that communities that are predominantly African American and Latinx already face higher air pollution burdens from the kind of urban pollution, the industrial sources in cars and trucks. So having wildfire smoke in these communities exacerbates those situations. There's also equity impacts in rural areas. They tend to be less affluent. Folks that are stuck in that wildfire for weeks and weeks at a time may not have air conditioning to be able to try to filter out some of those particles. They may not be able to afford to run their air conditioning if they even have access to it. One of the ways that California and the federal government are starting to address the forest management and improved forest management is by increasing the use of managed fires or prescribed fires to try to restore fire to the landscape, get back to more of what we sort of naturally need to have. But of course, this creates additional smoke in the air. At CARB, we've put together some tools to help the public understand what's going on. There's an app called California Smoke Spotter, which just it shows you the prescribed fires that are being used in California, and it helps predict where the smoke is going to go for the day. So helping people plan, understand what the smoke is. We're adding wildfire to this app. So for this wildfire season, you'll also be able to see estimates of where smoke is going from wildfires. We also have programs to try to talk to the public about understanding where the smoke is and how to protect yourself. We've deployed over 100 portable monitors to caches around the state, and when there are wildfires and prescribed fires, we put up these monitors to help provide information to the public about what smoke and air quality is like in their communities. We want to keep people informed so that they can protect themselves. And then there's also a new program this year called Clean Air Centers. We're working with districts to set up places that people can go if they can't protect themselves in their homes, centers that have filtered air or portable air cleaners to try to provide a refuge for them in these areas when we have a lot of wildfire smoke. So that's like a very, very quick tour through what CARB is doing on for wildfire and prescribed fire, and working to protect folks in California from those climate change caused incidences. So I'm going to hand it back to Sam for the next presentation. Thanks.
Great, thank you so much, Edie. And we'll move forward now to Dr. Lisa Miller, who will also have a set of her own slides. Awesome, thank you.
Okay. Here we go. Great. Okay. First of all, thank you very much for the introduction, Sam, as well as the invitation to participate on this panel of distinguished speakers. This is looking forward to the discussion after this. So I wanted to see if I can move this up here. There we go. I wanted to first start off by talking about what One Health is. This is a phrase that sort of gets tossed around and has actually been a more intense focus due to COVID and the transmission of infectious disease, particularly that of zoonotic nature. But in the context of climate change, it also plays an important role, particularly as populations, large groups of people live closer together and then live closer to environments that can influence their overall health. So a One Health approach really tackles human health concerns by looking at the problem at all angles, from the human perspective, the animal perspective, which I'll talk about later or in a moment, as well as the environment in terms of toxicants, and then plant material. So the necessity of this One Health approach is illustrated perfectly in the study of human health impacts from wildfires. So Edie gave a perfect introduction to why we're so concerned about wildfires. They're more frequent and prolonged. One of the challenges that we face now from wildfires currently, as opposed to wildfires that took place, decades ago, is this wildland-urban interface. So what is this? This is the transition between the location of the wildfire itself and human development. So as populations continue to expand, we need to build homes closer and closer to areas that experience wildfires. And what we're learning from, and what we've learned from these most recent events is that it's not just the combustion of the biomass, the trees, the shrubs, et cetera. It's the combustion of the biomass with man-made materials from homes that can likely create increased toxicity of the smoke that is generated from these events. So what can we do about this? So data is absolutely critical as scientists to inform public health, as Edie illustrated. And I'm just taking one example of the various monitoring, air quality monitoring sites that provide scientists like myself data on events that are taking place acutely, and as well as allowing us to track prior events. And again, giving us information on overall exposure. So how can animals help us understand human health effects of wildfires? So certainly we can learn a lot about the wild animals that live in areas exposed to wildfire smoke. One of the studies that I've directed over the past decade, actually, here at the California National Primate Research Center, is a study of rhesus macaque monkeys that live normally outdoors at our center and have been exposed periodically to wildfire smoke resulting from a number of events over the past, again, 10 years. Our center has over 4,000 animals, and at least half of them at any point in time live outdoors in large breeding colonies, and they represent all ages across the lifespan. And so this lifespan analysis allows us to longitudinally track our animals over time and look at the effects of the exposures from early life all the way through the aging process. So I'm going to stop there, and I will turn it over to Sam.
Thank you so much, Dr. Miller. I love the picture of the monkeys on the playground. That's adorable. And on that same, kind of like along that note of how important data collection is, I'm going to pass it over to Dr. Herring, who will tell us a little bit more about some of the really cutting edge methods that are being developed for aerosol data collection.
Thank you very much, Sam. It's an honor to be here. So thank you for giving me a slot in your session. So I don't know, I'm going to talk more about a general sort of introduction to the field of measurements rather than so much specifically about what we have done. So let me, and that is, you know, when you talk about air quality, the criteria pollutants listed by EPA are those that are generally cited: the carbon monoxide, ozone, nitrogen dioxides. And these gaseous pollutants are characterized chemically. They have standards based on the specific chemical constituent. But when it comes to particulate matter, it all gets grouped into either PM10, referring to the mass of particles below 10 microns, or PM2.5, referring to the mass below 2.5 microns. But yet, this particulate air pollutant is the most visible part of air pollution. As you can see in these two photos of the Southwest, it can just obscure the air. So if it's such an important part of our air quality, and it is what we think of in these smokes, why is it just sort of all lumped together? And I think the answer is because it's too complex, not because it belongs to be lumped together, but simply it's too complex. And we have here on the write a electron micrograph of
Oops.
particles,
I'm sorry,
tar
Dr.
balls.
Herring. Just to interrupt you for a second, I think we're not actually seeing your slides right now.
Jeez. I shared my screen. Okay. Share. All right. I'll start. Okay. Thank you. All right.
Thank you.
So let me go on to the next one. So I was saying that the reason the particulate matter all gets sort of lumped together is because it's so complex. These particles shown in the micrograph on the left they can have different sizes, shapes, morphology, different chemistries. These particles here are all from a wildfire. They're wonderful photographs from Peter Busek. Concentrations, well, by number, they can be in the thousands to millions of particles per cubic centimeter of air. There are thousands of chemical constituents. Sizes of concern range from 1 nanometer up to 10 micrometers in size. Yet the regulated parameter is the mass collected on a filter over a 24-hour period, often with the measurements done in a laboratory afterwards with answers not immediately known. So when we look at, can you see this whole screen? I should ask.
Yes. Yeah.
I can't see it all.
That looks great.
All right. So the question is then, what, when, and where? You know, the same 3 questions a journalist asks: what, when, and where. What being which parameters are most important to measure? You can't measure it all. What kind of time resolution, real time versus the filter collection? Where? Outside, inside, what communities? So there's a lot of questions to be addressed on what it is and where and when to do the measurements. And how we answer those questions depends on why. The why has to do, are we asking about questions of health? Then are we looking at specific chemical compounds, the polycyclic aromatic hydrocarbons that come from combustion? Are we looking at the ultrafines also from combustion? Are we looking indoors in classrooms, in offices? Or are we just looking at urban air quality? What makes that sky hazy in the first slide? And what communities should we look at? If you're asking the question of visibility, you also have to consider the hygroscopic nature of the particles. How much do they grow due to the humidity, which is going to affect the visibility? And comparing sources, long range versus what is that? Do you guys hear that noise? I'm sorry. Long range versus transport versus local sources. And then another question is, are you just trying to unravel the science of what's going on? What are the sources of particles that give us more clouds than we used to have? What happens in the mix of natural and anthropogenic emissions? And so then, because answering these questions is so difficult, what I do as somebody developing measurement methods is to look at the intersection among the whys. For chemistry is always of interest. There has been a lot of developments with single particle mass spectrometers, looking at single particle composition, looking at just a handy way to do an overall composition to see how air quality, particulate air quality chemistry changes around the world. There is looking at the number concentration of the ultrafines, which have absolutely minimal impact on the mass that is the EPA standard, yet these ultrafine particles have been directly implicated in health effects. And they're also extremely important for climate because they're so abundant. And we can see when we have bursts of these ultrafine particles, some of them will grow into a size that becomes a cloud condensation nucleus and will enhance the formation of clouds. So what we have worked on are these number concentrations, and I show here on the right some data taken from Riverside on number concentrations measured as a function of time, and you can see they're highly variable. And concentrations here ranging from 10,000 to nearly 50,000 per cubic centimeter of air. So one of the things that we've been looking at is making these measurements with smaller and more robust systems. And so we have here our little condensation particle counter. It's a system that can be run on a battery. It can be run in an office. Has been run on the streets of New Delhi in their rickshaws. And so this gives us a way to a smaller tool for being able to assess these particle concentrations. And one of our more sort of exciting things was to be able to, in the last year, is we put one of these instruments on the International Space Station. So we've been monitoring the particulate air quality that these astronauts are breathing on the International Space Station. So we're looking towards moving towards more affordable, smaller, but yet accurate measurements with an aim to globally provide tools for global mapping for climate, for being able to look indoors, schoolrooms and workplaces, and to be able to look in more diverse communities instead of just having, say, 10 ultrafine particle monitors for the whole Bay Area or for all of the South Coast Air Quality Management District that are in just a handful of communities. We could have multiples of these, but there's always a trade-off between cost, size, and accuracy. And this is, I think, an important question as we look at how popular it's become to have indicators of particulate mass on your iPhone, regardless of how inaccurate those measurements are. They are extremely popular. So I think there's a question of what and when and where gets added to it. How accurate must that measurement be? And how deployable must it be? Is it a reasonable cost? Is it, are you able to maintain it? And can you get the data off of it easily? So these are the challenges that we've been facing and kind of the focus on our work. And my little graphic there on the left shows some data from the space station where you can see that the concentrations are generally very low, except during certain events when the certain activities that promoted generation of these high concentrations. Highly variable, that peak is over 15 minutes. So you can see from here to here. So that's the thrust of our work. And I turn the panel back over to Sam.
Thanks so much, Dr. Herring. That was really cool to see how the technology has really developed to become more accessible, and like you were mentioned, this aim to develop more affordable and wide-scale real-time monitoring tools. And one of your points being that we don't only monitor very specific small areas, but that we're aiming to characterize more representative communities and more diverse communities. And so I think it would be great if we can kind of move along that theme and go back to, I know we only have 8 minutes and these are such important topics, but as we kind of had discussed as a small group before this panel, I want to go back to one of the questions for Edie that kind of wraps around this idea, and any, Dr. Miller and Dr. Herring, jump in whenever you want, but kind of for each of your organizations and your research progress toward that goal of having information that represents California more equally. Starting first with CARB, how does CARB kind of reflect California's diversity, and what are you currently doing to improve that diversity, even just at CARB itself?
Well, let me talk just a little bit. I'm going to talk a little bit sort of externally to build on some of the things that Dr. Herring spoke about, because I think that our traditional air quality monitoring it's regional based. And she talked about, you might have only 10 monitors in the whole Bay Area or 10 monitors in the whole kind of greater LA area. And there really has been a switch, partly due to some new programs that the legislature put into place to look more at what's happening in communities. Because
Yes.
air at the regional level might look really good, but if you live next door to a rail yard or downwind of the port or right off a busy freeway, that's not getting picked up in the system. And
Yeah.
so the kinds of technologies that Dr. Herring is talking about are really, really critical for us to get a better handle on what people are actually breathing. And so that's a huge effort that we're working on right now. She's absolutely right. The big challenge is like, what do you prioritize? Because there's no free lunch. So that has been a big thrust of our efforts. And I think as part of that, it's also made us have to look internally within our organization. How well do we represent California? Are we able, we are a state agency that is trying to provide a benefit to all Californians, and are we representing all Californians? And I would say we do okay. We're a very technical organization. We have 1,700 staff that are mostly scientists and engineers. So we are not very well represented when you look, especially compared to the state's population, when you look at representation of Latinx members of society and also Black members of society. It's not as great as it could be. We're doing better in some areas. Our executive office, there's 8 of us at the executive office level. We have 6 women in that group, and half of us are BIPOC. And so that's actually, I think that we're starting to sort of, at least at the leadership level, try to model that there are things that we can do. So there's a lot that we're doing, but I want to make sure we only have 8 minutes. I want to make sure and give folks other time to talk, but happy to talk about this more with folks that might have questions.
Yeah, thank you so much, Edie. And along those same lines for Dr. Miller and Dr. Herring, just if you could kind of follow up on Edie's comments on the actual environment that you're working in and how representative you feel like your cohort is.
Well, if I may, I would like to actually speak to the first part of Edie's comments, which is looking at community monitors, which is being diverse just in saying we're going to try and monitor air quality in all communities. And that needs different tools than are at the centralized monitoring sites. And there has always been this sort of catch-22, if you will, in air quality monitoring. And because the standards are set based on health, but unless there's a measurement that can say whether or not there's a health effect from this, then there is no standard. And so it's almost like there can't be a standard because there's no measurement. There can't be a measurement because there's no standard. So it is a really big motivator for those of us developing instrumentation for the California Air Resources Board to say that these small community monitors are needed, and we need measurements that are accurate, not just something that goes up on the web, some random number. We need accurate measurements. And so this is having that come down from the top as an important thing to do is a very important aspect of motivating the instrumentation development.
That's such a great point because I'm actually working mostly in water quality, and we have exactly the same barrier where because we don't have the data, we don't know, and then we really need it to be coming from the top to say that these are the areas that are underrepresented in the data, and we need more resources going there. And we only have 2 minutes left, so I'm going to pass it on to Dr. Miller to kind of give us
Oh, yeah. Thank
Yeah.
you for the opportunity. So this is a great panel in the sense that we represent various aspects of scientists. As a basic scientist, we collect this data, we take this data and we analyze it. And oftentimes, particularly in academia, we forget that we have to communicate the data, not just to our colleagues, but to the general public. And so we need to work on ways to improve our ability in our communication style so the public understands. The other aspect of that is that we as communicators need to look like the population we are communicating to. So that means we need to improve the pipeline and improve opportunities for underrepresented communities to get training in these areas so that we do look like the communities we're talking to.
That is such a great wrapping up point, and it really, as you know, somebody from the university, we have that opportunity to have academia become that great equalizer so that we have scientists and, who can really reach communities effectively. And we have a lot of work to do in that realm, but I want to thank all three of you as just amazing scientists that are really inspiring to me and my students. And I hope that we have a chance in the future to chat again. There's just so much here. Thank you so much for your time.
Thank you.
Thank you, everyone.
Thank you.
Thank you.
Thank you, Sam, and panelists Edie Chang, Susanne Herring, and Lisa Miller. It's so important to see the connections between climate and human and animal health, clearly from the work that you're doing. I appreciate the themes that you really drew out of increasing diversity of leadership in your organizations, which leads to recognizing needs for diverse data and instrumentation that's going to get us that data. Also, I love the last point about needing to improve communication and for the communicators to reflect the communities that we want to reach. Those are all such great points and very apt for today's theme and conference.